So today we are discussing IPL and what does it treat. Now the IPL, the machine that we have, it also has a refirm head, which is a separate treatment. So don't think that when you hear about the refirm that we're discussing this as well. This is a separate head and a separate treatment completely, even though it does operate on the same machine. So the IPL is what I tend to, as laser nurse, do quite a bit. And the thing is that it's not a laser. It's not going forward. Oh, there it is. Okay. So what I try to explain to people is that, and I like this illustration because it kind of has the rainbow spectrum, is that IPL is intense pulse light. And the difference between light and laser is laser tends to harness a specific wavelength. I tell the people that, light creates a rainbow. And a laser is taking one of those colors out of the rainbow specifically, harnessing it and using it to treat specific things. IPL has every single one of these wavelengths, and so that's why I really like this. It tends to work on and handle so many different things at one time. And the good thing about it is that, what was I going to say? You don't have to have excessive energy levels like you do with a laser to really get a good treatment. But as you can see here, it hits the surface, it hits just below the surface, it hits where the veins in the red, it hits around the sebaceous glands, around the hair follicle length, and it even goes as far down as hitting the collagen building cells. So it treats several things at once. Sun damage is what we use IPL for the most. This is what most of the people, when they come in and they want IPL treatment, this is what they're wanting to fix. This is going to be the brown spots, the patchiness, even some of the reds that you see. And as you can see here in some of the before and afters, that you can see several of the dark circles, and then they come over here and the IPL has broken it up. And even the difference between the hands, the color of the hands, how that's severely pigmented, and then the lighter shade over here, even on the décolletage. And I like the IPL because it's not limited to just the face or just specific areas of the body. There's pretty much not an area we can't do IPL on, whether it's the back, whether it's the legs, the feet, the hands, the neck. There's even people's ears. We can do anything. Now, how does it work for the sun damage or the dark spots that you see? And I really like this illustration because what it does is with the different wavelengths, they're going to target different chromophores. And for this, the light is going to hit the melanin, and the melanin is going to absorb it, and it's going to heat up and it's going to expand. And when it heats up and expands, then it breaks apart. And when it breaks apart, the body gets rid of it in two different ways. The ones that are closest to the surface, it gets fragmented. And it kind of almost looks like little coffee ground stain kind of scabs. It's not even really a scab, it just kind of comes to the surface. And then it just naturally exfoliates away. And the deeper melanin that's down here that hasn't quite come to the surface yet, and that's another reason I like the IPL treatment, because it'll get the sun damage that hasn't surfaced yet and that you can't see. Your lymphatic system is going to carry it away, similar to the way your body gets rid of a bruise or anything of that nature. It's going to carry it away and get rid of it. And then this is the skin that you're left with your normal melanin, your DNA genetic level of melanin. Vascular lesions is another thing that we do for the IPL, but not so much. It does a pretty good job of, like, rosacea patients really like this. You can see here she's got several little small veins. And then it usually takes 5 to 6 treatments of the IPL for both the sun damage, the vascular lesions, anything that we're treating, it takes several treatments. And then as you can see here, that most of those lesions are gone. How this works is the same thing. Like when I showed you that rainbow spectrum, it hits several different layers. So it has a wavelength that targets the red chromophore. And so the same thing, the red chromophore in the blood vessels, it absorbs the energy, and the absorption of the energy causes basically a vaporization of the vein. It vaporizes, it heats up, it destroys the vein, causes the vein to collapse, and then as it collapses, your body gets rid of it. The way it would a bruise, it absorbs it back, filters it out, and then you're left with a nice clear skin at the top. Acne is another thing that is good for IPL. And this we usually do about 2 weeks apart, where the other treatments we do about 4 weeks to 6 weeks apart. And on that rainbow spectrum, there's the yellow and green and the reds, and that's what the acne is affected by from the IPL. The yellow and the greens, they hit the acne and they destroy the bacteria that's in the acne. And then the red helps to kind of calm down the production of the sebaceous gland, which produces most of the oil. And then here's the demonstration of that, of how it goes in the areas that it hits. Oh, I keep forgetting I have the little red laser. So as you can see, it's here. It's not quite the level of the hair follicle, but it hits those more surface areas with the red and the green and the yellow, so that the acne clears up. And it also takes care of the redness that you get with the acne. It also gets rid of the redness. Laser hair removal is another thing that IPL is used for. And this is important to know because if you're doing just sun damage, treatment for people, if it's men, they may or may not want their beard affected. They're coming in for sun damage. So knowing, as you can probably see here in this picture, here's his nice, normal full beard, and then you can see it's really patchy after about just 3 treatments. So if men are coming in for sun damage, it's important that we make sure that they know, well, this is going to affect your beard. Do you want this to, are you okay if your beard gets patchy? Because some will say, oh no, so then we only treat from here up. We don't go over their hair. We also don't get far enough to the scalp that we affect people's hairlines as well. Because if you hit the hairline up here, if you're getting too close, you can cause them to lose their hair follicles and mess up their hairline. Same thing with eyebrows. If women have cosmetic tattooed makeup on, eyebrows, lipstick, etc., we have to be very careful the perimeters that we get. But some women like the fact that it actually does hair, and some men do too, the fact that it does hair removal, because they're like, I'm tired of shaving, I hate shaving, go ahead, do it. And then, as you can see here for this woman, she didn't like how her sideburns were doing, so the IPL effectively removed the hair for her. So she was happy with that. And it's the same thing that just kind of keeps getting repeated. The wavelength that hits the hair follicle, the hair itself is what absorbs the energy. So it has to be the dark hair. The dark hair follicle, and that's why the hair has to be in the hair follicle for it to actually work, and that's why it takes several treatments. And the hair itself absorbs the energy, vaporizes, and the vaporization of the hair itself, the steam and the heat from that, is what damages the hair follicle and causes the hair to not grow back. So that's number one, why it takes more than one treatment to do hair removal. And number two, why the hair, they can't wax or use the depilatory creams that actually remove the hair follicle from the hair. It needs to just be shaved or to be extremely very short. And that's also why not all hair follicles are active at the same time. So we have to wait for that hair follicle to be active and actually have a hair in it for the laser hair to remove, or the IPL hair removal to work. Wrinkle reduction. Now what's nice about the machine that we have is that it combines IPL light, which does hit to that collagen building layer, but we also have radio frequency with the IPL. And that's why it's important that we get very good skin contact when we're actually doing the procedure, because if we don't have good skin contact with the IPL, with both of the little metal things that are on the side of the IPL, the radio frequency can arc and burn them. And so the radio frequency combined with the IPL, they kind of extenuate each other. So you get a much better treatment with the collagen building levels. So where you can see here, right here with this little red level, this is where IPL would go on its own and radio frequency would go on its own. But when you combine them together, they go a little bit deeper. So we really get a good treatment to the collagen level of the skin. And while it doesn't take away a lot of the deep folds, it gets rid of a lot of the surface, as you can see on this woman. She didn't get these deep wrinkles right here, but as you can see, some of these finer ones up and around here, they were eliminated, if not made better. Oops. And that's it. Okay, and the test. I have the test. I have the test in my pocket. Okay. So, number 1. Does IPL have one or multiple wavelengths? Two, what do we use or what do we treat with IPL the most? What condition? Okay. 3, the melanin that comes to the surface as a scab. Oh wait, sorry. I didn't go over this. So, true or false? True. Melanin that comes to the surface as a scab should naturally exfoliate in 1 to 2 weeks. True or false? Sorry. I did? I said 1 or 2 weeks? Okay, I knew it said it come to the surface and actually exfoliated, but I don't think I gave you a time limit. Sorry. Okay. Okay, what system filters out the deeper melanin that gets broken up? What system, what body system filters out the deeper melanin that gets broken up? I think I said that, didn't I? Huh? I did? Okay. I went over the test a couple of times just to make sure I covered everything, but I do remember I skipped the 1 or 2 weeks. Okay. Okay. Rosacea and spider veins are vascular lesions that can be treated with IPL. True or false? Heat from the IPL causes the vein to collapse. True or false? 7. What color of light kills the bacteria in the acne? There was 2 colors. 1 will work.
I don't know. Were they a reliable source? Will you tell us who it was?
Okay. 8. What color of light targets the sebaceous glands? What color of light targeted the sebaceous glands? I know I went over that. Okay. Why should IPL providers be cautious going over men's beards? And what type of energy is delivered along with the IPL light on our system that stimulates collagen? Okay, there's another type of energy that goes along with the IPL on our system that we have here that stimulates the collagen. What is that?